hospitals running out of beds, emergency room wait times doubling, and surgeries postponed for months. Canada is facing a critical moment where the healthcare system may no longer keep up with demand if population growth continues at the current pace. Welcome back to Canada Chronicles. If you're new here, don't forget to subscribe and turn on notifications so you never miss important updates. This video matters whether you are a permanent resident, an international student, a temporary worker, or someone planning to immigrate soon, because these policy discussions could affect both your immigration future and your access to quality healthcare once you're here. We are digging into the growing political pressure to slow immigration due to the healthcare system struggling like never before. Let's get started. The crisis many don't see. Across Canada, hospitals and clinics are overwhelmed. Patients wait hours in emergency rooms and months for essential surgeries. Many Canadians struggle to find a family doctor. In some provinces, more than 1 in 5 people do not have reliable primary healthcare access. Walk-in clinics report lineups well before opening, and some close early because they lack enough nurses and frontline workers to operate safely. Hospital staff describe conditions where every shift feels like a critical emergency. Stretchers line hallways, paramedics spend hours stuck outside waiting to hand over patients, and surgeries that could prevent disability or disease progression are delayed again and again. Healthcare professionals are exhausted after years of heavy workloads. Many are leaving the field, retiring early, or switching careers entirely because conditions have become unsustainable. Colleges and universities are expanding training programs, but current graduation rates cannot replace the staff being lost. Meanwhile, Canada's population continues to grow. Every person needs medical care throughout their life. Vaccinations, prescriptions, routine checkups, emergency services, and long-term treatment. Yet investment in healthcare infrastructure has not kept pace with that growth. More people without more resources equals more strain. This pressure on the healthcare system has sparked a heated political debate. Immigration under the microscope. For decades, Canada has relied on newcomers to strengthen the economy, fill labor shortages, and support communities with declining birth rates. But today, many provincial leaders say immigration planning must consider whether hospitals and clinics can actually handle the growing demand. Their message is clear. Immigration levels cannot be based solely on workforce benefits. They must account for pressure on hospitals, family doctors, mental health services, and long-term care. It is important to note that no official law has changed yet, but the direction of national discussions indicates that future targets could be adjusted if healthcare pressures worsen. This uncertainty is already being felt. Processing times for some study permits, work permits, and permanent residency applications have increased. Draws for certain immigration pathways are more selective. People who believed they were close to approval may now face a longer and more competitive path. Who is feeling the impact today? International students are struggling to access primary care in major cities. Many are asked to rely on overcrowded walk-in clinics because family doctors are not accepting new patients. Schools want to welcome students, but support systems around them are stretched thin. Temporary workers who hope to transition to permanent residency are concerned that new rules may shift priorities toward applicants in health-related industries and essential services. This could mean greater competition for those outside priority fields. Families applying for reunification are dealing with longer wait times. Some provinces are signaling they may reduce sponsorship intake if healthcare access continues to decline. Seniors, who depend heavily on public healthcare, are experiencing the sharpest impact. Diagnostic procedures such as MRIs and CT scans have longer queues. Surgeries for chronic conditions such as hip replacements and cataract treatments sometimes face delays that significantly affect mobility and independence. Healthcare workers educated abroad want to help, but are slowed by complex licensing processes. While ensuring safety and quality is essential, delays in credential recognition mean qualified professionals remain out of the field while hospitals desperately search for staff. These challenges show that the strain affects both Canadians and immigrants. When the system weakens, everyone feels the consequences. Why politicians want lower immigration growth? Supporters of a slowdown argue that this is not about shutting Canada's doors, but about strengthening essential services before welcoming more people into the system. Their reasoning highlights several major concerns. Patient safety is threatened by overcrowded facilities. Nurses and doctors are burning out, leaving shortages even worse. Surging demand for healthcare makes it harder to control wait times. Other public services, including housing and education, are under pressure. Integration requires more support than is currently available in communities. They argue immigration must be managed differently in order to protect long-term stability. Why others strongly disagree. Opponents of slower immigration warn that reducing intake could create new problems. They argue that internationally trained healthcare workers keep hospitals running. Aging demographics demand more caregivers every year. Strong immigration supports the labor force needed to fund public services. Critical industries, including agriculture, construction, retail services, transportation, hospitality, and education, all depend on immigrants. These experts worry that cutting immigration too much could weaken the very system politicians want to protect. Fewer people working means less income tax revenue, which limits funding for healthcare improvements. In their view, Canada should urgently expand staffing and infrastructure rather than reduce future workers and taxpayers. What you should do if you want to come to Canada. For those outside Canada planning to apply, submit complete applications early and track processing updates. Develop skills in labor shortage sectors such as healthcare, trades, and essential services. Keep backup pathways in mind in case program eligibility changes. Maintain strong financial documentation and compliance records. For those already here, renew medical coverage before expiration to avoid gaps. Consider moving to regions that offer better access to healthcare and faster settlement opportunities. If you work in a health-related field, enhance qualifications now. Your skills may soon be top priority. Stay informed about policy announcements that could reshape your timeline. The more prepared and adaptable you are, the stronger your chances remain, where immigration policy may be headed. While changes are still being discussed, experts expect some combination of the following approaches. Immigration targets may be lowered temporarily to strengthen services. Intake could shift more heavily toward essential healthcare workers. Provinces could receive greater control over who they select based on local hospital capacity. Study and work pathways that are not aligned with labor shortages could become more competitive. This shift represents a new era where Canada's immigration strategy must match service capability. The hidden issue, what most people miss. Thanks for staying with us this far. We appreciate your time and hope you're finding this information valuable. Here is the turning point most people overlook. Immigration adds demand for healthcare, but it also supplies the workers who keep hospitals functioning. Without internationally trained staff, many emergency rooms, long-term care homes, and home care services would struggle to operate at all. Rural communities already rely on immigrant nurses and doctors just to keep clinics open. In major cities, foreign-trained professionals support essential services during peak demand. If immigration were reduced too sharply, staffing gaps could widen. More clinics might reduce hours or shut down. Wait lists for life-saving procedures could continue to grow. Communities could lose the services they depend on most. This creates a race between two urgent needs: reduce strain now or protect the labor needed for the future. And here is where opportunity comes in. Those in healthcare roles could soon receive priority processing, new federal and provincial incentives, and faster pathways to secure permanent resident status. But those in low-demand occupations could face fewer options, tighter eligibility rules, and longer timelines. The future will reward those who adapt quickly to changing priorities. Canada's healthcare crisis is forcing a major review of immigration planning. Some leaders want slower population growth to protect essential services. Others insist immigration must continue to support the very workers needed to repair the system. For thousands of current and future applicants, this moment represents uncertainty and possibility. Acting early, aligning your plans with Canada's needs, and staying informed will give you the greatest advantage. If you found this helpful, make sure to subscribe and comment below with your questions. We reply to as many as we can. See you in the next video.